Case 2 is of a 55-year-old woman who presented with dyspnea, easy fatigability, and signs of precapillary pulmonary hypertension, right precordial heave, strong second pulmonic sound, right axis deviation, and echocardiographic findings suggesting pulmonary hypertension with repercussions in the right ventricle. The initial diagnosis was primary pulmonary hypertension. Frontal and lateral chest rentgenograms revealed a straight pulmonary artery segment, minimally prominent central pulmonary arteries, and peripheral densities in the right side with a blunted right costodiaphragmatic angle. Note also what appears to be either a high dome of the right hemidiaphragm or subpulmonic effusion on the right side. The peripheral densities were nonspecific. Retrospectively, they represented areas of pulmonary infarction. The lateral chest rentgenogram only revealed the presence of a blunted costodiaphragmatic angle posteriorly, probably secondary to pleural effusion, but we could not appreciate the parenchymal changes noted in the frontal view. Perfusion scan to your left revealed large and moderately sized pulmonary perfusion defects, highly suspicious of pulmonary thromboembolism, particularly in view of a almost normal chest rentgenogram except for the right lung. Note that the ventilatory scan on your right side revealed almost normal ventilation study, except the right lung showed photopenic areas in the periphery of the mid portion of the right lung. This is an area that corresponded to the densities seen in the frontal view of the CT pulmonary angiography revealed a large filling defect obstructing the right pulmonary artery. Note enlargement of the pulmonary trunk. We also see the peripheral densities of the right lung and evidence of a right pleural effusion. Lung windows in the CT pulmonary angiogram showed the peripheral densities. Some appear rounded, others appear triangular. Note also some paucity of the pulmonary vasculature in the dependent portion of the right lung. Coronal slightly oblique reconstruction confirms the presence of a large filling defect in the right hilar region. Note the peripheral pulmonary density with a medial convexity, a classic Hampton's hump, and the image to your right is at another level, showing the peripheral densities and the filling defect corresponding to a pulmonary embolus in the right pulmonary. This is an embolectomy specimen from the right and the left pulmonary artery. Angioscopy was performed at the University of California in San Diego, followed by elective right and left pulmonary embolectomy. Note the filling defect, the enlarged central pulmonary arteries, and the amputated branches of both pulmonary arteries. Classic findings for chronic pulmonary thromboembolism.